I was very interested to become an endocrine surgery consultant because it is something that merges clinical medicine and surgery. So you have the combination of the surgical skills and application of that, in addition to the clinical medicine, which requires a lot of concentration before treating these patients. So endocrine surgery is that specialty that deals with organs that secrete hormones. So function is very important, and when we operate on these patients, it's important to limit it to the amount that needs to be removed. And there are some, obviously, complications and side effects that we need to be aware of. So using technologies, for example, like fluorescence dyes for injecting them and identifying certain parts of the patient or glands like parathyroid glands and thyroid surgery that need to be preserved because that gives a better outcome for the patient. This is something that I'm very interested in doing, and it kind of makes the outcome much better for the patient. Once a diagnosis is made, I will have a discussion about the treatment options, whether that's surgical. I will also discuss non-surgical options and surveillance, for example. The patient will be at the center of the decision-making process. I will discuss cases with my colleagues, endocrinologists, radiologists, and oncologists, and the case will be discussed in the multidisciplinary meeting. In the end, it's a shared decision process with the patient. So we'll have all these discussions, and in the end, we will agree what's the best possible treatment. What sets Cleveland Clinic London apart is the expertise, the people, and the communication between different groups, and this is all for the best interest of the patient. Now, it's also the ability to apply the technologies and the devices. We have access to that at Cleveland Clinic London, which will be all deployed for the patient's best interest.